No, my name is Erastus. Erastus is, I'm trained in medical laboratory technology, and I also preach the gospel. We are here at Freedom Embassy Church to assist them to do what they do, as we do what we do as medics. So we have assembled a team of medical staff. All cadres of medical staff that are in the hospital are here, except surgeons. And this is the only camp that we are not having surgeons. This is the only camp that we are not having surgeons, because when we carry out medical missions across the country, we also go with our surgeons that do surgical operations on the ground. But today, the church that we are in, we are not near a health facility where we could carry out that. So today we are offering services that can be offered outside, and we are doing consultation for all health complications someone could have. So we have specific services also. We have cervical screening for the ladies. We have prostate cancer screening for the men. We have eye backed up by Bowes Optical. They are doing eye checkup. They are giving the glasses for those that require them. Those that require better services, we are referring to the bigger facilities where they can be assisted. We have lab tests. Here we are doing like around six different lab tests. The ground here, those that can be able to be run here without the requirement of machines. So we have the rapid tests that are being run here for malaria. We are also running for typhoid. We are also running for venereal diseases. We are checking that. We are also checking urinalysis. We are checking a few of the cases there. And also PSA for men. We are also having cervical and dental. We are having dental checkups. We have a dentist actually who is checking on the cases. Majorly what we can be able to do here for dental is extractions and advice on oral health. But other operations that require a hospital, we are taking them to the government hospitals that are around. So we have guys here from Kiambu Hospital. We have guys here from Kenyatta who are working in Kenyatta. They are helping us on the referrals where we require to do those referrals. We have a well-stocked pharmacy. All the medicines required to treat basic ailments are here. And maybe you have passed there, you have seen that we have stopped there. We have Dr. Mbai, who is the chief pharmacist, who is manning there, and the staff that are there. And we are basically helping the church to do their CSR, because the church has been here. They are concerned about the people that are outside, that surround them, of course, as they preach the gospel. So this is one aspect where the church is getting to tap into the medical profession as they bring in people as they preach to them. So we are coming in handy to support them, and that is what we are now doing here today. So we are happy you have come to check on us, even to tell other Kenyans what the church is able to do. They have spent quite some amount of money in trying to mobilize the medical staff, because some of the medical staff are on our pay by the church, and they have come here to come and simply do the work of the church as we treat the patients for free. But the materials are not for free because they have been bought, and the church has done the payments. So that is what we have here. We have quite a number. We have seen around 80 people by now. We are continuing to see, and we expect to see close to 1,000 patients by the close of the day today. Close to 1,000. We have the staff that can be able to see all those patients. When we have, because we have shortages of a few things, as we continue to work, we realize we didn't have this, we didn't plan for this. We have various other people who are helping us. We have Rayonda Hospital Pharmaceuticals, so that if there is any pharmaceutical thing that is missing, they have run. They have run like twice now to bring those things that are required. So that is basically what we have here. You are welcome to our church. Tomorrow we are here again, but not treating the patients with the medicines, but treating the hearts of people through preaching by the pastors that are here. We are inviting everyone. Tomorrow is the day for visitors to come and celebrate together with us. Reports will be given. MOH of the area is expected to come here in the afternoon. The director of, there is a director who is supposed to also come, because the certificates will be issued for the medical staff that has been able to serve with us today. So basically that is why we are here, and we are happy that you also have come. You can also benefit from the services that we have. We have qualified medics that are working in every other place that you go to be seen. They can see you here without having to produce your card or to have to pay with the money. So God bless you. Unless you have any questions, that is, we can go back to work.
My name is Florence.
Yes, Florence.
From Legacy TV Media team. And the question I would like to ask is, can you explain to us how physical health relates to spiritual life of the society?
Thank you so much. We say as clergy, we say a healthy person physically is a healthy person spiritually. When we preach to the people to get their spiritual healing, and somebody is unwell and sick, basically even what we are trying to explain to them about the salvation, about Christ, they don't even get it. But when we come now to the area where we reach into the areas of their problems, when they are sick, we come in handy and try to assist them. That is where we try to bring the connection between the physical and the spiritual health. And that is why sometimes you find even the church is introducing an aspect of a clinic. Like now this church is planning to open a hospital in the long run. To begin with a small clinic, then from there it can become a full-fledged hospital. Like we have so many mission hospitals. It is that in that regard, in that line where you need somebody that is healthy for the church to be healthy. Somebody who is healthy is somebody who is able to pray. Somebody who is healthy is somebody who is able to take care of their children. Is somebody who is able to work. So that is how we try to connect this and help the people where we can. So because of that, and the church does not have a facility where they could refer those that are sick, that is why now they have had to contract the medical officers from wherever they come, those that are in groups and those that come as individuals, so that they can come and treat the patients. Of course, as the missionaries do their work, that's how we are connecting this. Yes. It is something that we have been carrying out for more than 10 years now across the country. Basically, like for now, we have a mission that is going on in Rumuruti. Our team is in Rumuruti. There is a team in East Pokot just today. That's why we have very few here, because we have had to divide into 3 groups. So people are treating out there as we preach. We are also treating the patients. Where we can be able to establish a health facility for continuous medical services, we are doing so. Yes.
So my name is Edgar, a freelance journalist. My first question, currently the state is under, I think, one of the biggest social media handles that people have been using, to educate people on issues to do with the health and also things to do with spiritual, that is TikTok, is under, I think, a predicament whereby I think soon it will be somehow being shut down. And what do you have to say about this? Because this is one of the platforms that people have been using to educate others when it comes to issues to do with mental health and also health in general. What do you have to say about this state of TikTok being under predicament?
Social media, as it were, has an issue. It is a good aspect and a tool to pass information, but it has been infiltrated by so many other people. Somebody that creates content to bring into the social media that is injurious to the community. Well, the government has a responsibility to control them. If controlling them means closing, then that is for them to determine. But there are positive aspects of the social media that cannot be underestimated. Us, as the medics, we have been able to pass information through these social medias very easily. Like now, the camp that we have here, too much work has been out there on social media, the Facebook and all that, to try and mobilize these people to come, including forming a team of medical officers that are coming from across, because we are coming from across the cross-section of the health facilities, the government plus the private, like I am in private practice. But there are others who are coming from the government who are here. So it is this social media that we use to mobilize and bring all these people on board. So if there are issues of TikTok that are being regulated probably by the government or given punitive measures by the government because of what probably they have been able to, or maybe they have been unable to control what goes into them and what goes to the public, then I think what I can say is the government has a responsibility and they know how to deal with this matter by themselves. So for me, I will not be able to attack the social media as per se, but I will say maybe if there are issues, there are government regulations that they need to follow. Yes.
My name is Duncan from Nairobi Gossip. Of late, the clergy has been facing some issues with for example, in the case of Pastor Ezekiel having a whole clinic and a whole hospital and all that, in relations to fasting. Now, you as a doc and as part of the clergy, is there safe fasting or a way that someone who needs spiritual health should fast as he end up to kufa for it?
Thank you, my brother. I will not mention the same televangelist for what they do. But what you need to understand is fasting is biblical. It is taught in the Bible from the beginning to the end. You will find teachings about fasting. But what we have in the cases where you have people dying because they have been fasting or they have been told to fast, that may not be what is taught in the Bible. I will invite you to read the book of Matthew, where Jesus is teaching about fasting and how fasting should be done, and try to relate with what you have found out in your journalism work, what has been happening out there, if it relates with what Jesus was teaching, or the fasting that has been done even in the Old Testament. If it doesn't, then it is for you to judge. But fasting is healthy for the members of the church. It is actually in all the religions. Muslims do fast for 30 days in the month of Ramadan. We fast every time. Even today there are people who are fasting. We do not have a specific month which we fast as Christians. But now, if there are excesses in the people that are saying they are fasting and then until they die, I don't know whether we have seen that example in the Bible. I haven't found anywhere in the Bible where somebody went to fast until they died of starvation. Yeah. Because if that happens, then you get into trouble with the government, because the government has a responsibility over the people, and the well-being and the health of the people is important. So when the government comes in, because people are dying in the church, then the government has a responsibility. But fasting is healthy. It cannot be condemned because some people have misused it somewhere, or because they have taught some heresies that probably are not found in the Bible. It cannot be condemned because of that. So the Bible stands to be true, that fasting is biblical and we all need to fast because it was taught by our Jesus Christ.
In terms of regulations, the government closing the churches.
Yes.
Like in the case of the said televangelist.
Yes.
Do you think that is too much or what is your take on it?
That one, I saw that one yesterday.
Yes.
I saw there were some churches closed yesterday. I do not know what informed the closure of the church. I do not also know what information the government had which caused the closure, because the church has a regulation on how it is regulated, how it is registered, how it is operated, and how it should run. So if those parameters given are passed, then the government comes in. Unless we are told this is what the government found out, that these people flouted this and this and this rule, and therefore the government could not allow an organization that is injurious to the public, then that one we can discuss. But as it is, the government has closed some churches because maybe regulations have been overlooked. So I have not read very seriously to know exactly why it was done. But the investigation has been going on from the time that we had the issue about Shakahola. There were investigations that the government has been doing through DCI and NIS. Those the areas that the areas of government that do investigations have been doing their work. So if it has come to a point that the investigations have pointed to issues that are detrimental to the public, then the government has a right to take the position.
A question, eh?
Yes.
I need to ask this question because it has been maybe surrounding one of us, one of the content creators, and of course people have been asking themselves, is this true, or is this right, or it is wrong? Eh? Taking ARVs with, like, you are taking ARVs at the same time you are taking alcohol. So you can tell us, is that right, the right way, or it is the wrong way? And if it is the wrong way, you can tell us the side effects of that. The other question is it right to take medicine with maybe soda, tea, something?
Well, thank you for that question. I would be general, not specific to ARVs as you said. Basically, all medicines have the way they are absorbed in the body. There are drugs that are absorbed in the mouth. There are those that are supposed to be absorbed in the stomach. That is why you go to a doctor and they tell you, take this one with water, so that water flushes that medicine and then it begins working from the stomach. There are those that you are told to chew, because absorption of the same will be undertaken through the mouth. So the enzymes that are in the mouth are the ones now which are supposed to absorb those medicines. In the case of ARVs, I don't know which specific brand of ARVs you are referring to, but medicines have specific instructions. So the ARVs have their specific instructions. If alcohol affects the absorption and assimilation of that medicine, then you are told to stop it, including many antibiotics that we take. There are some antibiotics that you are given and you are told to take them with water only. There are those that you take and you are told don't take certain other things like milk. We tell you don't take this with milk or anything with milk derivative, because milk will hinder the absorption of that medicine. So each patient, as they are given the medicines, they are supposed to listen to the instructions given behind those medicines so that they can be able to work for them. So basically that's what I would say on that. Alcohol is a problem to some medicines. It is a problem to some medicines, and in those, when the pharmacy is issuing you the drugs, they will give you the instructions that are relevant to them.
So generally, for someone for someone who is HIV positive, is there any possibility, like, okay, is it safe for him to be taking alcohol?
Let me say, HIV is safe for any food. There is no food that you are told not to take because you are taking HIV medicines. We do not have any contraindications with the medicines barely for the HIV. So HIV it is safe to take almost anything. People are taking alcohol, they continue taking their alcohol, but we are preaching that they stop taking that alcohol. People take all types of food actually. There are no specific foods that you are told not to take because probably they will interfere with the medication that you are taking. So I don't think that one is a big issue for HIV specific patients.
Okay, I'd like to ask the last question, and I'd just like to know if there are ways a participant can continue to participate in this health and wellness after this camp? Are there ways in place, plans?
Yes.
Participant can continue?
That is a very good question. I was supposed to finish with that. Thank you so much, sister, for bringing it up. We, the members of the media, are very, very important in what we are doing. Very, very important. Sometimes we want to pass some information, and we do not know how to pass that information to the relevant people. We are doing this across the country. We are doing this for various purposes, but the major purpose is to preach the gospel. We are running a mission, for example, the ones that we run in Pokot East. In Pokot East, we have been able to reach the bandits. We have been able to talk to them out of banditry now to the church. Some have gone to school because their age was that of school going. And this information needs to go to public, because when someone who has been doing wrong for quite some time realizes the other partner has left it and has come and they are doing well, it sends a positive message to that person that they can change from those ways that are being condemned from all corners, and they can follow. So in our preaching, for people to leave alcohol, for example, we have a community that has been ravaged by alcohol. Most of the leaders have been talking about somewhere around Mount Kenya and such like. We went to Mukurweini last year, and we were doing the medical camp there. That is one of the major problems that came, where the masses, the men, the women, the youth are all affected to the level that it is affecting their health. So as we handle their health, we realize there are underlying factors that needs to be handled first. Government cannot do it alone. The chiefs cannot be able to contain this alone. Awareness needs to be done on the negative aspects of those behaviors that they have, which are detrimental to their health. Like when we are now going to the Pokot East, we are doing this camp as we are doing these medical services across. One, to preach the gospel. Two, to save people from starvation, because we are also feeding them. Three, we are helping those that are doing banditry work. You know, there we don't call them bandits. There they are good people, you know. We don't call them bandits there. So we go and we speak to them, and they leave their habits and they come to the church. Some get into the community service and then get some good works to do. If we do not have the aspect of the media to help us penetrate this, even the government itself will get it wrong. And in this, I would say, having been in East Pokot for close to 10 years now, I would say in many instances where you hear kuna mauaji hapa, many times the government get it wrong. Because what happens is a thief going to steal cows. And when they steal cows, whoever owned the cows says, my cows have been stolen by a Pokot, for example. Now, when the government comes, instead of running to look for that thief, they are looking for a Pokot. And we've been telling the government and all the officers that are on the ground, there is a difference between a thief and a community. Because if you steal, you haven't stolen for the community. You have stolen to go and enrich yourself. Yes. So when the government comes, they should go and look for you as a thief, just like they look for other people here in other parts of the country. So the aspect of the media coming to cover and telling as it is on the ground is very, very important. That we like it. If you can partner with us, we will work. And it will be a very important tool for us also to pass the information that we have. Yes.
Thank you.
Thank you so much, guys.